This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor.
Good morning. How are you?
I'm doing very well. How are you?
Good.
Great.
So in the last few weeks, we've gotten some new younger patients coming through the practice that recently had a baby or have had more than one child and are ready to start addressing the wear and tear that happened down there from childbirth.
And indeed it is, wear and tear.
Yeah. And what I love about these patients is they're taking care of themselves in a way that I feel like my generation didn't, or, nothing was available to us, but we weren't really even discussing it. It was just accepted. So I like that these patients are being proactive and wanting to do everything they can to rejuvenate the area after childbirth.
Yeah, that's absolutely true. People are paying more attention to this. And there are two things that basically happening that cause the symptoms here, which can either be vaginal symptoms of pain with intercourse, vaginal dryness, which is associated with low estrogen levels if they're lactating, and also damage that's done during delivery that has stretched the pelvic floor, soft tissues, and with the additional weight that often has gone along with the pregnancy, they have problems with urinary incontinence. And 50% of women who've had a vaginal birth will have a degree of stress incontinence, meaning they cough or sneeze or laugh or run downstairs and they leak urine. And it bothers them in their exercise classes. It bothers them on a routine daily basis. They just don't feel good about themselves. So both of these things are going on. They're relating to estrogen and to damage.
Well, and two, a lot of patients, they lead with, I just want it to look and feel like it did before.
Right.
Okay, so they're not even going into specifics. They're saying something super simple like that.
Yeah, they want to be made functional again or feel good about themselves. And, up till 8 years ago, we didn't have much in our holster to be able to help these patients. We could use estrogen vaginal cream, which helped. They could do Kegel exercises to support and strengthen the pelvic floor. And that was, or they could have surgery. And the standard of care treatment for stress incontinence is a sling, a mid-urethral sling, just to keep the urethra in place when somebody coughs or sneezes. And it works really well. But that's invasive and doesn't always work and can be associated with significant complications. It's generally a safe, very good operation, though.
But mainly the patients coming through that have just had kids that are just really just stretched out and like maybe they're not having any urinary issues. They just don't like the way sex feels and they don't like the way it looks.
Yeah, the appearance issue is more difficult to deal with. Well, first of all, if there is anything that's untoward, it's usually because of a laceration that wasn't adequately repaired. But that's not usually what they're concerned about. The postpartum patients are definitely in the way it feels. So, as I say, almost all we've had in the past is giving vaginal estrogen, which is safe and effective. But about 8 years ago, there was a technology change in that a laser technique that was used for facial skin resurfacing had been adapted to be used vaginally and was found to really help the recovery of vaginal tissue in terms of collagen amounts, blood vessels, blood supply, and health.
Yeah.
And I must admit, I was pretty doubtful to start with when I heard about this. And it was shortly after that there was the arrival of radiofrequency electrical treatment that did pretty much the same thing.
Do you think these treatments for women, the vaginal rejuvenation treatments, I mean, obviously we've talked about it many times on the podcast. Do you think it's good for women to start these procedures earlier rather than waiting?
It sort of depends. I don't think it needs to be done, 1 week after delivery. But maybe if those symptoms are going on beyond 6 months, then yes, I think it's a really good idea. And as I say, I was pretty doubtful to start with these treatments, but when I saw some of the histological studies that were done, which showed incredible differences to the mucosa, because of the laser or the radiofrequency, it was pretty remarkable, and that's when I adopted it. And frankly, it just changed my practice.
Yeah.
And now I'm in it. Well, going back to that time, I was so impressed and have been so impressed with it that I would say that I don't know any woman that this wouldn't help.
Yeah.
Even somebody who hadn't had vaginal deliveries or had incontinence issues. Because for some people with recurrent infections, vaginal infections, this works really well to strengthen the mucosa, make it more resistant to infections. So it's been incredible. And since that time, as I say, 8 years ago, there's been a gradual change in the technology that makes it better and better. And it's very safe. It's painless. It's one of those wonderful treatments that requires no preparation time, no downtime afterwards, no pain. That varies, actually. I have to say that some of the procedures can be uncomfortable, but we never need to use anything more than local anesthesia for it. It's safe and it's effective.
Yeah. And
the only downside is that they're not covered by insurance. So there's a price factor there that's a concern. But it's, again, changed my practice.
Great. Thank you. Thanks for listening. And if you have more questions, please let us know, either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.